Hi, friends, and welcome back to Behind the Stethoscope. I am your host, Dr. Elizabeth Brand. I am a new grad veterinarian, and I am just trying to figure everything out like the rest of you guys. First, before we get started, I want to thank you guys so much for such a great positive response on my last couple of episodes. There has been so much engagement, so much comments, so many people have messaged me. So I want to really thank you guys for such a positive feedback to what I've started. It has brought up conversations with my coworkers and just open and honest conversations, which has been really fun to kind of start having those deeper conversations with people and just hearing what they're going through. In my own personal life, I feel like it has brought up a lot of conversations with my friends, and it's been so fun to see how what I'm talking about has translated to a lot of different professions and personal lives too. Having the conversation of this life is hard, or having the conversation of I don't feel like I deserve that, whether that's relationships, whether that's your job, whether that's getting a raise at work. It's been really interesting to hear other professions or other people talk about what I'm talking about in their personal lives or in their lives too. So I really want to thank you guys. If you guys like these episodes, please share it with your friends. Getting the word out and spreading it honestly starts those conversations and can get a deeper meaning in what's going on with your friends or your coworkers. So last episode, we talked about imposter syndrome. This episode, we're going to relate to that, but we're going to talk about mistakes, the ones that keep you up at night, the ones that you really regret, or even the small mistakes that you don't even think about twice about, but sometimes it still beats you up. In this profession, we hold on to our mistakes way more just because of the type of people that go into this profession. We are type A, we are perfectionists, we want everything to go exactly how it should be. But unfortunately, medicine doesn't work like that. And I think that's why it's called practice, is because it doesn't work like that. I wish it did. I want it to be, but it definitely doesn't. I feel like mistakes in veterinary medicine definitely holds a lot more weight because of what's at stake. We have lives at stake and emergency. We have to make quick decisions, and it's super easy when you make a mistake for it to have a bigger impact down the road. All right, so let's talk about it. Let's talk about first of why I feel like mistakes hit so hard in veterinary medicine. For me personally, I work in emergency. We have hit by cars come in, we have seizing dogs come in. You have to give the drug, give the dose right away. You're ultrasounding while also talking to the owner, while also trying to talk to your technicians. A lot of things are going on at once, and you say the wrong drug dose and it kills a dog, or you do something wrong, or you miss that really big tumor on the spleen. There's so many things that you can miss in such a short amount of time, and you're making quick decisions. But those mistakes like haunt me personally. You're like, I should have caught that. I should have saw that. I should have heard that in the history, because you're trying to do 100 things at one time, and each skill that you're trying to do, whether that's listening, whether that's talking to your technicians, whether that's recalling drug doses or ultrasounding or listening to the heart with your stethoscope, all of those skills require such a fine, important skill and 100% of your attention. But unfortunately, in an emergency setting, you don't have that. And so when you make a mistake, you go, I know better. I should have caught that. And it haunts you because sometimes it is life and death. In this career, I feel like those hit really hard, especially when you lose a patient. In this profession, we care so deeply about animals and animals' lives that if we do something to cause them harm, or we cause harm to that animal that affects another person, that hits us hard. We wear it on our shoulder. But I think, like, realistically looking at mistakes, not all mistakes are equal, first off. You could delay a diagnosis. Even though you get there, you missed that changes on the blood work that you could have gotten to that diagnosis sooner. Whether that's a wrong drug dose, even though if it doesn't harm the patient, let's say it doesn't get its full pain meds because you got the wrong drug dose. They're all so different, and not all mistakes are equal. And mistakes in general, we're not perfect. We try to be. We're not God. We're not greater than now. We are humans. We are going to make mistakes, and forgiving yourselves for those mistakes is part of being human. So I want to challenge you guys, especially our new grad veterinarians, go easy on yourself. If you're a pet parent that you're listening to this and this happened to you, understand that we are humans as well and we do make mistakes and we have checks and balances to try to help with that. But at the end of the day, we are all humans and we all make mistakes. Hopefully, trying everything we can to not cost us a life at the end of the day. But unfortunately, like reality is, it does happen sometimes. It's never fun. It's never easy. In 2020, I started as an emergency technician. I was working emergency for 4 years during vet school. I was in the ER and ICU. So I have seen a lot of fourth year students, interns, resident, but also baby doctors in private practice come into emergency and be so afraid of making a mistake that they hesitate. In emergency, you don't have time to hesitate. And when I was a fourth year, when I came out of school, that was the last thing I wanted to be. I did not want to be a baby doctor. I was like, please no. And the term baby doctor is not a fond term. It doesn't come most of the time in a great context. To me, it's endearing. I honestly call myself a baby doctor sometimes because I feel like I'm still learning, but I would try to do everything in my power to not be a baby doctor. I was like, I am not going to make the mistakes that they made. And that's just unfortunately not possible. Yes, you're going to learn from other people's mistakes. Yes, you should learn from your own mistakes. But at the end of the day, there's nothing that you can do coming out of school or, again, 5 years down the road to prevent mistakes. You're going to make them. It is just going to happen. We need to do our best to prevent them however we can. And it's funny that I'm recording this episode when I am. I just got off an overnight shift, and last night was one of the shifts that if anything's going to go wrong, everything's going to go wrong. And that is exactly how that shift was. And there was a couple mistakes that were made that could have been prevented. And we had a huddle, we all talked about it. And I think my message to everybody was mistakes are going to happen. You have 10, 30 seconds, a minute to sulk in it, to beat yourself up over it. But after that minute, 5 minutes, whatever you need, we have other patients. We have other lives here. We have critical patients still coming in the door that we need to reset and move on. Not to say, hey, that mistake happened, shoved it in the corner, put it in the closet, it never happened. We need to learn from the mistakes. How can we prevent that from happening again? But also, we can't beat ourselves up over it. And I think that relates to veterinary medicine very commonly. A lot of people who are in veterinary medicine can think about a time in their life where they made a mistake. But I think that translates to a lot of other professions and personal. Raise your hand if you made a mistake in your life, just personally, professionally, whatever. Like me, and I can name so many mistakes that I made in just in the last year that either one I regret or two, it threw me into a path of so much growth that one, I didn't even know I needed, but two, I didn't even know I wanted. Those are hard mistakes to learn, but you grow so much from them. Mistakes don't make you a bad doctor, it makes you human. And the new grads that are so scared of making mistakes coming out of school, I hear you. You're heard. Your feelings are so valid because I was right there with you. But also at the same time, like, that's how you learn. Lean into that. Don't hesitate. Lean into those mistakes. Ask questions. How can I improve? How can I not make that mistake again? Whether that's in an emergency situation when you have a hit by car come in and you're ultrasounding and getting the history and throwing out drug doses and talking to your nurses. Do you just need to slow down, like one at a time? Let's talk about your history. Okay, I'm going to hear about the history in a second. Let me ultrasound. Or one technician and be like, I want this drug dose. Sometimes it is slowing down in those emergency situations. Sometimes you just need practice. Practice makes perfect. Practice prevents mistakes, and you just need more practice sometimes. And that's not a great answer for some people. And that's not the only answer for some people. But forgiving yourself in those mistakes, learning from those mistakes, talking about those mistakes. Sometimes we get shameful or embarrassed, I think is probably a better word, of our mistakes. And so we don't want to talk about it. We don't want anyone to know about it. We just, again, want to shove it in the closet and never talk about it again. But talking about those mistakes, owning up to them, and then talking about them has growth for more than just one person, and learning from other people's mistakes too. That was one of the things that I had to learn as a baby doctor of everybody makes mistakes. Those veteran veterinarians make mistakes too, and it's not just me. And having those conversations with those people and learning from the things that they have done in their past will help you so much. But sometimes you do have to learn the hard way and make those mistakes yourself. And one of our new grads who came out of school in this past May made a mistake. It didn't cause a dog's life, nothing like that, but it overdosed a dog. And we had a conversation of these mistakes and she learned from them. I had another shift with her and she like triple checked her drug doses. She was like, okay, I want this drug at this drug, like looking it up more often because she was so traumatized by that. Any vet or pre-vet student, or even if you send a wrong email to somebody, I promise you, and as you know what I'm talking about, you're going to triple check to make sure you're sending it to the right person. You're going to triple check those drug doses for months to come because it was just so traumatizing and you're going to learn from those mistakes. So if you are a new grad veterinarian and you're listening to this, or you're about to be a new grad veterinarian listening to this, I hate to tell you this, you will make mistakes. That's just how it is. It's medicine. We practice for a reason, but you're never going to be perfect. It's how you respond to those mistakes, how you learn from those mistakes that are going to make or break what kind of doctor you're going to be. So I challenge you guys to lean in. It is okay to ask questions. It is okay to make mistakes. Forgive yourself from those mistakes, but also learn from them. Don't put it in the closet and hide it. And that goes for personal life too. If you make a mistake, I've made plenty of them. Stand up. Hey, that's on me. Own it. I really challenge you guys in 2026 to own up to your mistakes, learn from them. So things that I have learned about self-forgiveness. How do I forgive myself for making those mistakes? So 4 things. 1, separate who you are from what you do. It is so easy to put your identity into this field. We'll have a whole episode on that. But separating yourself, you are not a bad person. You are not a bad doctor for making a mistake. I think that's like number 1 and first and foremost. 2, let's talk about it. Let's have a conversation about it. Let's put things in place to make sure this doesn't happen again. 3, you ask, what did I do wrong? Just like replaying it and saying step by step, what can I learn and grow from that situation? I think that one's really important. But 4, remember that perfection isn't the goal. Being compassionate, continuous learning, growth, competency, I think is the goal. That's the goal in veterinary medicine. Not perfection is not you being, that's not human. That's like an unrealistic expectation for anybody. Mistakes are going to happen. You need to forgive yourself. Again, you are going to make mistakes in your life, whether you are in vet med, a new grad, any profession, or personally. You are going to make mistakes. You need to forgive yourself. So that was a really hard pill for me to swallow in my personal life in 2025, was to forgive myself for my mistakes. But you have to move on, and you have so many more cases to see. You have so many more emergencies to see. You have so many other mistakes to make. You need to forgive yourself to move on to the next one. That's our topic for today. Now we're going to go into case of the week. I am so excited to talk about case of the week. It is one of the wins that I've had over this past month. I had my first GDV surgery. So if you guys don't know what GDV is, it is basically a flip stomach. So usually deep-chested dogs come in, they're retching or like dry heaving almost is what it sounds like, foaming at the mouth. We're talking about Great Danes, Dobermans, German Shepherds, sometimes Golden Retrievers or Labs, come in retching, really bloated stomach, whether that is drinking too much water too fast, inhaling food where their stomach gets really big and distended, like a balloon is how I describe it, and it flips on itself. Cuts off circulation to the spleen, part of the stomach. It is life-threatening. It is a severe emergency. So I had one come in We took an x-ray, it was flipped, had the whole conversations with the owner, said all the risk, and they said, yes, go for it. And so we went into emergency surgery. I unflipped it pretty easily. We tacked the stomach down to the body wall so it doesn't flip again, and the dog did great. It was such a win. This is a surgery that I've wanted to do for so long. I've had multiple of them come in, but unfortunately, a lot of the owners pursue humane euthanasia just due to the age of the dog or complications, whether it was cancer, whether there was something else involved. But it was so fun to actually do the surgery, actually like get my hands into it, tack the stomach down. So it's been some time. That is my case of the week because I was so excited to talk about it. Anyway, so how I like to close this episode is one, thank you guys again so much for coming. I really appreciate it. I appreciate the support. I appreciate the enthusiasm that you guys have for what I'm doing here. I love doing this. I love having these conversations. I think it's so important. If you like this episode, if you like the next episode or the previous ones, please share and subscribe with your friends. And I hope you guys have a great week. We will see you next week on Behind the Stethoscope. Thank you guys. A little disclaimer, this content shared on Behind the Stethoscope is for educational and informational purposes only. This podcast does not provide medical advice or establish a veterinarian-patient relationship. Any cases discussed are very generalized and anonymous, and pet owners should always consult their own veterinarian for any medical decisions regarding their animals. And opinions expressed on this podcast does not represent my employer or any organization. They're my own opinions.